Today we're going to talk about doing a bridge, whether you articulate your lumbar spine or hold it in a neutral position. If we have a lower back injury that has a disc pathology or a SI joint pathology, if you roll up where Kathy is showing you now, where you tuck your pelvis under and roll up your spine, what you actually do is create the space here, as you can see in the spine, where you open up and spread the space between where this disc could push out, or if you have a ligament strain. So this could be good for articulation, but anybody who has a back problem, we need to come down and actually do a hip bridge. So if Kathy holds a neutral spine now and pushes up where she keeps the spine to the hip line straight, you're actually keeping your lumbar erectors on, transverse on, pelvic floor on, and lower back down. As you work through this movement, you'll become more aware of how your body is supported by your back extensors, your glutes, your hamstrings, and your core. If you tuck under, you overemphasize your abdominals and you open up the foraminal space behind the disc. So the space at the back of the spine here gets opened up. You can also then stretch the ligaments and also impinge the nerve or allow that disc or pathology to actually push out even further. So this is very common in what they call a Pilates roll-up, which can be used to work the abdominal muscle. But if you've an underlying lower back issue or spinal pathology, it is not advised. So we see a lot of clients coming that have a disassociation here, or what we call a faulty recruitment pattern, where the muscles have been taught to move in an abnormal way. The normal recruitment would be to hold the spine in a straight position and do a hip thrust. One of the best exercises to develop the glutes. One of the strength conditioning coaches that I follow, Brett Kattar's, the glute guy, shows through EMG studies and has done his doctorate on glute activation to fire the glutes to keep the spine in this position. So as Kathy's doing those, anywhere from about 2 to 3 minutes, 20 plus reps, and as you progress, you can eventually put a weight bar across your chest, or sorry, across your hips, and then do a hip thrust where you can start to advance the exercise.